Hello everyone, welcome to the channel Nursing Guru. You're watching Nursing Guru with Jabba Singh. Do you know what is shock? What are the types of shock? And what is the nursing responsibility during the time of shock? Let's discuss everything in today's video. Shock. Before I'm going to tell a detailed explanation regarding the shock, let's discuss few points. Your cell is made up of group of organelles. It is like a mitochondria, a ribosomes, endoplasmic reticulum. So many organelles form together to form as a cell. And the group of cells form a tissues. And the group of tissues together, it makes organs. And the group of organs, it created a body system. It might be a respiratory system, a nervous system, cardiovascular system. So many systems are present. And along with that, all the systems gather together and it forms a human body. So the base of human body is cell. If cell is not functioning properly, the tissue will not function. And if tissue is not functioning, the next organelles will, the organ of the tissue will be not functioning. If that organ is not functioning, the system of that organ completely collapses. And if that system is not functioning, then whole human body is in a problem. So the basic thing is cell should function properly. Each and every part in your body, it consists of cells. So it should be functioning properly. So cell need two things. Majorly it need two things, an oxygen and glucose. So now come for the definition of shock. Shock is defined as when a tissues in a body didn't receive enough amount of oxygen and nutrients, so the cell couldn't able to function. Next, let's see the types of shock. There are four types of shock. The first one is, as you can see there, it's like cardiogenic shock. Second one, hypovolemic shock. And the third one, it's obstructive shock. And the fourth one is distributive shock. So in cardiogenic shock, something related to cardiac system, if the cardiac system failures, it's the conditions which leads to cardiogenic shock. Hypovolemic shock, let's all discuss in one by one. When it comes for the distributive shock has been divided into three types. In that, the first one is neurogenic shock, the second one is anaphylactic shock, and the third one is septic shock. So these are the classification of shock. I'll just repeat it once again. The first one is cardiogenic shock, the second one is hypovolemic shock, the third one is obstructive shock, and the fourth one is distributive shock. And the distributive shock has been divided into three types. So that one is neurogenic shock, anaphylactic shock, and finally is septic shock. So these are the classification of shock. Let's describe the types of shock. So in that, the first one, the cardiogenic shock, it occurs due to some systolic and diastolic dysfunction. In the sense, when you don't have a proper cardiac output due to some cardiac disorders, due to some stenosis, regurgitations, if the patient is having some heart block, so what happened? The cardiac output will be not present. So if there is no output, that condition is called as cardiogenic shock. And the second one is hypovolemic shock. So as you can see the word hypovolemic. So hypovolemic means hypo is low, volume. It's a volume, low volume, mic or mia. Any conditions which related to mic or mia, it's related to blood. So low volume of blood, if it is present in your body, so that shock is called as hypovolemic shock. It occurs due to severe bleeding. Might be hemorrhage, road traffic accident. So severe bleeding, what happens? All your blood present in your body, it's been bleeding and it's come out from your body. So it leads to less tissue perfusions. So it leads to a shock that is called as a hypovolemic shock. In cardiogenic shock, what happens? Due to the cardiac output, decreased cardiac output, what happens? The cell couldn't able to pass. Why? Because due to the output, the RBC cells which carries the oxygen, it's been cut off. Due to that, there is no tissue perfusion, the decreased in tissue perfusion. Because of that, it leads to a shock that is called as cardiogenic shock. And hypovolemic shock, the reduced amount of volume of blood's presence in your body, traffic accident. And the third type of shock, that is called as a obstructive shock. The obstructive shock occurs. The obstructive shock occurs due to some physical obstruction present in your blood cells. How the physical obstruction is present? It might be because of some atherosclerosis, any fat deposits occurs over there, or due to some blood clot present in your body. So these are the obstruction present in your blood. Because of that, the blood vessels couldn't able to passes the blood to all the parts of the body, which decreases the tissue perfusion, which leads to shock. So this is like obstructive shock. It can also any sorts of obstruction. It might be a pulmonary embolism or air embolism. So any blood clot, thrombosis occurs in your blood, so it leads to the shock. And the fourth type of shock, what I told you, it's a distributive shock. It is categorized into three types. The first type is called as the neurogenic shock, and the second one, as I told you, it is anaphylactic shock, and the third one is septic shock. A neurogenic shock, it occurs due to some trauma which occurred in your brain or spinal cord. So what happened? The oxygen couldn't able to carry it out to your nerve cells. Because of that, the patient leads to a neurogenic shock. And anaphylactic shock occurs due to some anaphylactic reactions and hypersensitivity reaction which occurs in your body. Due to some ADR, adverse drug reaction, due to poison, or due to some chemicals what you have inhaled, or due to any sorts of allergic reaction which happen in your body if you get into a shock. So those kind of shock is called as anaphylactic shocks. Now the final kind of shock, that is called as septic shock. Septic shock is also called as blood infection. Septic is an infection. So blood poisoning or blood infection due to some bacteria. Due to some bacteria, if the patient is getting any sorts of blood infection, it does shock, which leads to a less tissue perfusion, which leads to a shock that is called as septic shock. So these are the classification of shock. So now the next thing we'll discuss regarding the etiology of shock. What are the causes of shock? Okay, there are types of shock. We saw so many varieties of shock. How that shock occurs? So what are the causes? We'll just go deeply. So first one, due to some allergic reactions. I told you severe allergic reaction, it is also a cause of shock. And the second one, due to burns. What happened due to burn? The patient may goes to hypovolemia. And also the patients will get into a septic shock because your skin is being as a protective barrier. Like this skin, no other PP kit can be able to protect you. So when this skin protective barrier due to burn, if you loses that, so what happens? It lead to a septic effect in your body. So because easily the pathogens, the microorganisms can get into your body. So because of that, also it is a cause of shock. The third one, due to RTA, common RTA, because of some road traffic accident, severe bleeding, it leads to an hemorrhagic shock. And any injury to the spinal cord, I told you, it recreates the neurogenic shocks. And the next one is like poisoning. Due to some poisoning effect, any chemical reactions or any drug toxic which is present in your body, it leads to a shock. So these are the causes of shock. And the next thing is due to some heart failure, due to some cardiovascular conditions, the patient is having some cardiovascular disorders. Because of that, the patient can lead to decreased cardiac output. The patient will have shock. So as I told you, cardiogenic shock. And the final one is due to infection. And the final one is due to blood infections. It also due to some microorganisms which occurs in your body. So these are the causes of shock. Next one we'll see regarding the clinical manifestations. So what are the signs and symptoms when the patient is having shock? In that, the first one is the patient goes to hypotension due to less cardiac output. So what happened? Less decreased tissue perfusions present in your body. The patient goes to hypovolemia. It also leads to hypotensions. The next one is the patient will be having weakness, general tired, the muscle fatigue. They'll feel tired always, and the patient will have severe chest pain. angina will be present for the patients, and the pulse will be very weak. When you are palpating the pulse, it will be like very weak, and profuse sweating. The patient will go into a period diaphoresis where the profuse sweating will occur, and dizziness. Always they will feel dizzy and confused state. The patient will have in a confused state, and suddenly they go to an unconscious state, and what happens is the patient will have rapid and shallow breathing. As you can see, how the rapid and shallow breathing will be. So it is a condition, and the patient will feel anxious, agitated, and confused. They'll feel always be like confused. They don't know what is happening in their surrounding. And finally, the patients also, due to less decreased perfusions of oxygen, it leads to cyanosis. That is the bluish discoloration of the skin due to decreased oxygen supply. So these are the clinical manifestation. So what are the diagnostic evaluations should be done during the time of shock? As first one has, you should be the history of the patients, what type of shock, when it occurs. So everything, the history collection should be done, and physical examination, you should go the system wise, what are the physical examination to be done for the patient during the time of shock should be done. And like all the techniques like inspection, palpation, percussions, and auscultation, so all the techniques should be followed during the time of you're doing the physical examination. Next, the blood culture and sensitivity test. Due to blood infection, the patient also go for cultural sensitivity reactions. So blood culture and sensitivity tests should be done for the patient, and increased complete blood count should be done. So if there is any increase in WBC or increase in ESR, erythrocyte sedimentation rate, so hope you can see the normal value of that. The next one is we'll be checking for the ABG, arterial blood gas analysis, whether to find out what kind of respiratory alkalosis or acidosis, metabolic alkalosis, acidosis. So those things we can able to find out. And due to less cardiac output, the patient also will have cardiac dysarrhythmias, irregular heartbeats. So it can be examined through ECG and echocardiogram. So any defects present in your heart, any blockages or aortic stenosis present in your body. So this can be observed in the echocardiogram. And CVP, so central venous pressures, which can able to find out the fluid loss in your present, how much is the fluid are present in your body. So those things also can able to, we have to visualize during the diagnostic evaluation. And when we leave this shock, just like that, the complication of shock, it leads to first loss of concentration. Next one, the complication of shock, when you leave the shock just like that, so it leads to first one, the loss of consciousness. First, the patient will lose the consciousness, and respiratory failure. Finally, it goes to respiratory failure, and next, the patient will be having the coagulation disorders. His coagulation profile, the EPT, APT, INR value, where there will be a varies in the INR count, and next, multi-organ damage. As I told you, every cells needs oxygen. Every cells in your body, it needs an oxygen nutrition. So if cell is not functioning properly, the tissue of the belonging cell will not function. If tissue is not functioning, the organ will get damaged. So multi-organ will damage. If multi-organ is damaged, so what it leads to a condition somewhat, it goes to a coma, and finally it leads to death. The whole system fails. Finally the human body also is getting failure, so it leads to death. What are the managements of shock? The next we'll discuss regarding the management of shock. The first management that you'll be giving with pharmacological management. So how to treat the shock? The first, you'll be providing with the IV fluids. First thing, you will provide with the IV fluids such as the crystalloids such as RL and NS. Next one, we'll see the management of shock. So in management of shock, it's been divided into two types of management. One is pharmacological and non-pharmacological. In pharmacological management, we'll be discussing what are the management, like what are the drugs will be given for the patient. Okay, so first one is aggressive IV fluid should be given for the patients. So when the patient have undergone shock, the first thing what you can give is crystalloids such as ringolatrate or normal saline, so RL, so they used to tell us, so that it should be given alternative for the patient. And the second one, due to the shock, less cardiac output, hypotension, inotropic agents such as dopamine, dobutamine, and epinephrine. So these are the inotropic agents, so it can be given for the shock. So it makes the cardiac functions to be normalized. Next one is vasodilators such as nitroglycerin, and the diuretics such as lacetone and furosemide, and antibiotics such as, because of septic septic shock, the patient also go to a blood infection. So some of the antibiotics we have to start, cephalosporin, augmentin, clavinucleate. So these are the things, amoxicillin. So we can provide these kind of antibiotics, and antihistamine due to anaphylactic reaction such as epinephrine can be given for the patient. Corticosteroids such as dexamethasone, corticosteroids such as dexamethasone. Sodium bicarbonate can be given for the patient for the metabolic acidosis, and bronchodilators such as atropine and aminophylline can be given for the patient. Pharmacological management can be done for the patients who are undergone shock. What are the non-pharmacological management? So first non-pharmacological management is modified Trendelenburg positions. Okay, hope you can see the slide over here. So the Trendelenburg position is the head end will be lowered and the foot end will be little bit tilted up. So while we are making like this, it makes a increased in venous rate and increased in cardiac output. So modified Trendelenburg positions can be given. And the second one can be, we have to assess the vital signs. Anytime the patient might be the hemodynamically stable patients, they may undergo any sorts of conditions. So it should be maintained. The vital signs should be consciously monitored, and administer oxygen of about 5 to 10 liters of oxygen through face masks you can provide for the patients. And the next one is parenteral nutrition. So the patient should get more amount of aggressive nutrition. So all the parenteral nutrition support can be done for the patients. And the surgical management, you can do an angioplasty, tracheostomy, and wound debridement. So these are the surgical managements can be done for the patients. So being a nurse, so how to assess during the time of shock is continuous monitoring of the vital signs, the assess for ABC, that is airway, breathing, and the circulation of the patient, monitor the ABG and the urine output of the client. So these are the assessment to be done during the time of shock. And some of the nursing diagnosis, hope you can see the nursing diagnosis. So impaired tissue perfusion related to the decreased cardiac output, so decreased venous returns, ineffective breathing pattern related to hypoxia, bronchospasm, fluid volume deficit due to vomiting, acute pain related to myocardial infarctions, so imbalanced nutrition less than the body requirements, so related to the vomiting, dehydration. So these are the conditions. These are the some of the nursing diagnoses you can formulate for your care plans. The condition called shock. Let's summarize the topic. So we are dealing regarding the condition called shock. So shock is nothing but it is when the tissues or in your cells, when the oxygen supply is not adequate, it's lead to a condition called shock. So we saw different types of shock, cardiogenic shock, and it is an hypovolemic shock, and the next one is an obstructive shock and a distributive shock. In a distributive, we saw the neurogenic, anaphylactic, and septic shock, and we have dealt with etiology, what are the causes of the shock, and we dealt with the clinical manifestation, so what are the signs and symptoms the patient will be having, and the next, what are the complications during the time of shock. Finally, we dealt with the management, what are the pharmacological and non-pharmacological management, what are the nursing assessment during the time of shock, and finally I gave you some nursing diagnosis. So that's it for today's video. Thank you for watching. See you all in the next video with an interesting topic. Until then, stay tuned. Bye.